Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Today I'm going to talk a little bit about bunions and how you can prevent them and improve them, keep them from worsening, and treat them yourself, hopefully without surgery. So bunion basically is a deformity of the great toe, your big toe, characterized by a lateral deviation of it. That means it goes sideways, outward from the midline. So imagine a line going through the middle of you and going straight between your feet. That's the midline. And bunions are when the big toe deviates to the side, and this gets progressively worse with wearing improper shoes and continued pressure on it. A lot of people usually confuse bunions with bone growth, but it's really not that. It's the bones that move out of place gradually, the great toe that moves gradually out of place due to wearing the wrong shoes or any abnormal pressure applied on the big side of the toe, and then forces the toe to move out of the big toes to move out of their normal position. So that hump, that joint where the big toe joins your foot, that gets pushed sideways, and then the tip of the big toe gets pushed sideways as well. So in other words, you start developing more and more of a hump, more and more of a protrusion on the inside of your foot where your big toe joins your foot. And if you feel you're starting to form bunions, there are a few things that you can do to prevent them. And if you already have them, here are some tips to lessen the effect of them, because if they get bad, bunions look like a big sore area on the inside of your foot, and the area is swollen, and you eventually can't use your legs normally and walk properly because they get so bad. So once again, as I said before, wearing the wrong shoes for long periods of time, especially ones that constrict the foot, or women in the case of high-heeled shoes that force the toes down, put a lot of pressure on the toe bed and the ball of the foot, and tapered shoes that are pointy in front. All those things will exaggerate the formation of bunions. Some of it's also genetic. You might inherit this from your parents. Also, foot injuries, trauma will cause bunions. And some ways of treating bunions are rest your feet more, wear loose shoes, go barefoot, basically try to avoid pressure on them, and wear shoes that don't have a tapered toe, that don't scrunch your toes together. And then also there's some good exercises you can do to lessen formation of bunions. So one thing you can do is to spread your toes apart. Take your shoes off, obviously, go barefoot, spread your toes apart, and then do that, hold them open for about 5-6 seconds, and then repeat that about 10 times, 4 to 5 times a day. And that'll train your toes to not be scrunched together and to open up, and thereby lessening the effect of the bunions. Another thing you can do is buy a toe separator. So toe separator, you can buy them in drugstores or medical supply places, probably even order them on Amazon, but they'll go between your toes. It's made out of plastic, soft plastic or foam. It goes between your toes and keeps your toes apart, kind of like when you're getting a pedicure and you don't want the toes to touch together and mess up the nail polish. Same type of concept. It spreads the toes apart, reversing the bunion effect of the bunions. And you should wear that for about 5 minutes, 3 to 5 times a day. And then take pictures too with your smartphone. Take pictures every day, and then after about a month or so, month and a half, you'll see a noticeable difference in the way your feet look. So anyway, to recap, wear comfortable shoes. Don't wear high heels if you're a woman. Make sure you buy a shoe that doesn't scrunch the toes together, and then do those exercises, and you'll notice a huge difference. Also, chiropractic adjustments can help with bunions by ensuring proper alignment of the toes, the ball of the foot, the area between the ball of the foot and the ankle, and also your ankle and knees. Make sure that you're walking properly, and that'll also prevent the formation of bunions. I hope this helps, and have a healthy day.